Before we start, here's something worth thinking about. It's that most of modern medicine is designed to treat the consequences of problems rather than preventing them from developing in the first place. My name is Alexander Young. I was an internal medicine physician at the height of the COVID pandemic. I supervised a family medicine department at a joint service military medical center, and I deployed twice as an active duty Navy medical officer. Now, as a veteran, I'm specializing in a field called preventive medicine, which is a field that most people have never heard of, but it's one that looks upstream at the systems and patterns in place that drive health outcomes. Throughout my journey in healthcare up to this point, I've kept seeing recurring patterns in place. It's that we're very good at treating the end result of problems and not so good at preventing them from developing in the first place. Think of conditions like hypertension, type 2 diabetes, cardiovascular disease, and even burnout. The environment may differ, but the patterns are the same, and these outcomes are often predictable. We build better rescue tools, we invest in developing better drugs and medical devices, but we invest far less attention and resources in the upstream factors that could have prevented these things from developing in the first place. Now, that disconnect is what drew me to the field of preventive medicine and population health. Now, here's the framework that I operate within. It's that health is upstream of and determines performance. Performance is upstream of and determines your wealth, and your wealth is upstream of and will determine your freedom. Now, a quick caveat before we go any further. There is tons of evidence out there that proves that at a population level, upstream factors such as policy, systems, social determinants of health, and other socioeconomic factors play a huge role in determining health outcomes. However, for this project, I'm going to be taking these ideas and applying it to more of an individual level, looking at how better decisions, better habits, and better system design can optimize your performance and your health. The project I'm launching here has several overarching aims that we'll address in future videos and articles. The first is to increase health literacy. Between sensationalist headlines, cherry-picked data, and very often manipulative marketing techniques that are being used against you to influence your behavior and very often get you to buy things that you don't need to buy, I want to be able to help you recognize those tactics so that you can understand when these are being used against you to help you make more informed, better decisions about your health. Health literacy isn't just about knowing facts, it's about understanding how the system works so that you can better navigate within that system. Second, we'll challenge the wellness industrial complex and the incentives behind it. This is a multi-billion-dollar industry that is profiting off of your health anxiety, very often by selling you the solutions to problems that don't even exist in the first place. Things like unnecessary lab tests or supplements or programs that more often than not aren't really doing anything for you. My goal is to separate the signal from the noise so that you don't waste your hard-earned money, your precious time on things that are really just unnecessary. Third, I want to talk about where the medical system has either underperformed or overreached. The American healthcare system hasn't always earned the public's trust, and understanding what medicine gets right and what it gets wrong, and having an open dialogue about this is part of building real health literacy. Fourth, we'll focus on the unglamorous fundamentals. Things that you've seen a million times and you probably know, and it could almost be argued that this is just common sense. Things like sleep habits, diet, nutrition, physical activity, stress management, things that, like I said, probably common sense, but they've been consistently shown to move the needle and have actual effects on your health outcomes. In a world full of fad diets and miracle protocols, I want to focus on what the evidence actually supports. Fifth, we'll break down public health news and research without the reactionary outrage or sensationalist headlines and really kind of help make sense of what's going on in the world of public health. And finally, we'll talk about systems. How to design your health and your performance and even your finances in a more strategic way. Because upstream thinking applies everywhere. If you're a student, a physician, a professional, or someone who just wants to think more clearly about health, if you value fundamentals over fads, if you'd rather design systems than constantly be reacting to them, then you're in the right place. On my YouTube and Instagram, we'll discuss these topics, have dialogues about them. And on my Substack, Upstream RX, we'll do a little bit more of a deep dive where I'll do more in-depth breakdowns, provide frameworks, maybe some digital tools or templates that may be useful for you. Different formats just to address the same philosophy. The framework is called Upstream thinking, and now it's not a term that I've coined or came up with. It actually is used in many different industries, but it's a powerful way to understand how systems actually work. There's a quote from the cybernetician Stafford Beer that I think illustrates this perfectly. He said, "Each system is perfectly designed to get the results that it gets." Meaning if you want different outcomes in your health, in our institutions, or in your personal life, we need to examine the systems that are producing these results. That's what upstream thinking is all about. Health literacy is self-defense. Upstream thinking is leverage. If you control the inputs, the outcomes will follow.